Summertime chilling, EQ spinning, contracts loyal, so I'm counting the digits. Skirt with the pan roof just whizzing, waiting on the roller, you know that's living. Catch me in the booth, just. Hello and welcome to another episode of Don't Tell My Wife podcast. Here with one of your hosts, Tonye,
and it's your boy Ken.
And man, back again, another episode, another week. Here with some very, very special guests in the building.
Come on.
If you guys could please
introduce yourselves.
Hello guys. So we are the Living Room Podcast. I'm Claudia.
And I'm Olivia. And as we say, the mic is on.
The room is sacred. Let's talk.
Oh, man. Thanks for having us, man. How's you guys' weeks?
It's been a busy week, actually.
It's been a busy
week.
a very
busy week this week, but it's been good. Productive.
It's been all right. The last couple months at work has been a bit.
Oh, is it?
Yeah, because September is 9 months down the line from New Year.
I'm a September baby.
What day?
Seconds. I'm the 8th.
8th. Oh, September. Christmas and New Year's.
Yeah, so everyone that got pregnant for Christmas and New Year's is giving birth now.
I didn't deep that.
Is there like a stat to show like where like a lot of people were born?
Do you know what? No, I haven't looked into.
I haven't looked, but everyone that works, September and November.
Oh yeah, November because of Valentine's Day. That's what I would have thought.
Yeah, but September, everyone always says like it's just September.
Very get a mouth.
So
our September babies, they would have figured that. Wait, how was your week?
Hey man, work innit?
Yeah.
I don't even remember my week, bro. Work.
Yeah.
Kids. Marriage.
I hear it, man.
I actually don't remember what happened.
I hear it.
Yeah.
This week has been a busy week. Stressful though.
Very
stressful, bro. But we thank God, man. We thank God. We can't complain.
How many kids do you have? 2. Okay. Do you have any?
One. And one on the way as well.
Oh, congratulations.
Yeah, thank you so much. So that's why
this will be helpful.
Family, you guys are here. For real.
Okay, it's not a Valentine's Day.
Nah, not a Valentine's.
No, I can't labeling all the seasons now.
So I've got loads of questions to ask you guys.
So how far along then?
She's just touching the third trimester now.
Nice,
so
exciting then.
Yeah. I know, man. I know. Should we get into a quick fire?
Yeah. So we're gonna do a quick game. Ken's gonna explain the game because I'm not a good explainer of games.
So what the game is, we basically ask you a question and then we tell. For example, let's say we ask you a question, you have to say if you think she can do it or she's lying. So let's say we say, okay, how many countries are in Africa? Or name me 10 countries in Africa, for example. Okay. You will have to say, okay, I can name 6. Then she'll be like, oh, she's lying. And then
fair enough.
You have to do it. If you don't do it, she gets the point.
Okay.
And if you do it, you get the point. If that makes sense.
Yeah.
I think it's called like lie. I can't remember what the name is.
Okay, cool. So the first topic we'll do is, do you guys like Afrobeats?
Yeah.
So what countries are you guys from as well?
Ghana.
Congo.
Yeah.
Congo, okay.
What about you guys?
Nigeria.
Both of you.
Yeah.
Okay,
Nigeria.
cool. Let's do Afrobeat artists. So
let's go for you first. So how many Afrobeat artists could you name? There's a time limit, so in like 30 seconds.
In 30 seconds, yeah, okay, cool.
So how many Afrobeat artists can you name in 30 seconds?
4.
Damn! No confidence! No confidence!
Okay, so if you think you can do better, how many do you think you can do?
Oh.
Yeah, all right then.
Now I'm gonna go 6.
6?
Yeah.
Oh, come on, guys.
No, because now I'm fumbling and my head is like...
I'm trying to think now on the spot.
Okay, so do you think she knows 6 or do you think she's lying?
I think she knows 6.
Okay, go on, name 6.
Name 6.
Name 6. 30 seconds.
Okay. Burna Boy, Ashake, Thames, Sarkodie.
I said Sarkodie.
Wait. Who's that guy that did Escalade?
That was me.
That
was Charlie Poppy.
Okay, fine.
Hey.
This is why I went for a safe number.
Oh, how long have I got left?
5 seconds.
Shit.
Wait, I think that was 6 though.
No.
I'm sure that was 6. I'm sure that was 6.
That could have been 6. Okay, we give you the point because I thought that was 6. How many was that?
I don't know.
Did you even say Whiskey?
No, she didn't.
She didn't say Whiskey.
No, but the pressure, because the first time you played this game.
She said Charlie Poppy. She said Shaka.
Okay, next
question. She said
question.
Shaka. That's 5, bro.
Okay, 5. So you get the point then. Okay.
But then
okay, so for you now, so how many train stations can you name?
Oh, I could do quite a few. I'm gonna go 8.
8. Okay.
I feel like I do a bit more probably.
Do you think she's telling the truth or do you think she's lying?
I think she's telling the truth only because she gets on the train all the time.
Cool, go on.
Alright, go on. 30 seconds. 3, 2, 1.
Grays, East Sam, Barking, High Barnet, Whitechapel, Liverpool Street, Monument, Farringdon.
fair. Well done.
1-1 then. Is it 1-1?
No, it's 2. She got 2. I know it was 1-1.
1-1.
Okay, last one. My bad.
Okay, cool. Alright, this is the side yeah? Alright, best out of 3. Okay, let's do countries in Africa. How many do you think you can name?
5.
5? Okay. Guys,
5.
This is bad, man.
In Africa.
I'm trying to say.
No, I hear that. Okay, cool.
How much I can name, or do I have to say she?
How much can you name? Oh no, do you think she's lying?
Do you think she's lying or not?
I think she's lying.
Okay. How much? Okay, cool. Go on then.
Okay, alright, cool. 3, 2, 1, go.
Ghana, Nigeria, Congo, Ivory Coast, South Africa. That's 5.
That's fine.
Yeah, fair enough.
You took the easy way out. That was bad. Okay, cool. Alright, send on with them. So obviously, thank you guys for coming on. Really, really do appreciate it. As we know, you guys are basically pretty much from your own pod anyway. You guys are student midwives.
No,
You qualified now.
Yeah.
Okay, you qualified now. Okay, that's great. That's even better. Okay, cool. So maybe I'd say just in like give a little background, obviously, to why you're wearing the pink shower for your brand, and then also why you started your pod, etc. And then we can go from there.
Okay. Why we wear the pink? I would say we love pink. Both of us die hard pink lovers. So
That's like my missus, but yeah.
when we started this, it was like we wanted to wear scrubs because that's what we wear in what we do our day-to-day lives. But wanted to be different, so we both love pink. So it was a no-brainer. It was just like, we'll go for pink.
Yeah.
I think it's
Brightest
cool,
pink
though.
you can
Yeah.
find.
It's actually
Yeah.
cool. I think that's what
That's our
stood
brand.
out to me when I first came across your pod.
Really?
It's like, yeah, the pink is actually cool still.
Yeah,
Yeah.
so
So
now
it's definitely good branding.
It's part of us
Yeah.
now.
Yeah,
so
literally.
pink scrubs.
Yeah.
And then, do you want to answer the second part?
Yeah, so I think obviously we're both obviously midwives, and we obviously know that black midwives are important because black women are 4 times more likely to die in childbirth. So we wanted to sort of make a representation. There's not much of us out there that are given information, and we also wanted to make it fun.
Yeah.
We wanted black girls to watch us and, you know, resonate with us, feel comfortable when they're watching us. Just because, because one thing that we always said, that even at work, like when we do meet black women that come in to give birth, like sometimes you do get quite a standoffish vibe from them, and you get it because they're petrified, because they know they're part of
A statistic.
Oh,
a statistic.
yeah.
So
Yeah.
we do sometimes, not everyone, but we get people that are quite on edge.
Yeah.
So we wanted to open a space that just made black women comfortable in childbirth, that they can watch us and be like, actually, I'll be all right, you know, when I go in hospital. It doesn't mean because I'm 4 times more likely to die that when I actually go in the hospital, it's not an enjoyable experience for me. So we wanted to sort of like bring like a fun vibe back into midwifery and just
as well as like just putting out information out there. 'Cause I think one thing we always say is like information is key and it's power. And I feel like there's a lot that we don't know. So I think just opening up that lid to these conversations to inform people but keep it fun as well. So,
and I think it's kind of like a release for us, because we do so much at work that you don't always get to speak about. So the
having
podcast,
that space come in and just yapping
it helps
away.
us unload a little bit.
It must be draining as well when you go through like the negative stuff at work as well. It must affect you like mentally. So
it definitely plays a role.
That 4 times more likely thing is crazy though. It used to be 5 times, didn't it? And then it went down,
reducing,
which is good. Yeah, I feel that. I still feel that statistic is crazy, because I know obviously I've been in the birth centre or whatever like twice now, innit? And obviously every single time I've gone, it's always that's things pounding in the back of my head. Like, make sure I'm advocating, make sure I'm actually present, etc. But as just a quick question, in terms of, obviously there are a lot more black midwives coming up now. Even one of our friends is a black is a midwife. Tara. Shout out her. She qualified. I think she qualified this year.
Yeah, I think
She
so.
qualified this year, and she was even. My wife was in labour on Boxing Day, and on every Boxing Day we do like a friendship tradition where all of us link up in it.
Oh, that's nice.
On that day she started her labour in it. So obviously it was good for us to have that release of our friends being there. So
to
she takes your mind away. But obviously we had a midwife right with us, so it was pretty easy.
Yeah.
But as now women stepping into that scene of being a midwife, do you actually think like how you can make a difference in terms of not getting the statistic down, 'cause it's a bit different, but in terms of like making sure that, is it that you can't pick your patients, can you?
No.
You just get assigned.
Yeah.
But is it that if you get someone, if you get a black woman or whatever, you just have to make sure that you have to make sure you're on the ball all the time.
Yeah.
But like, is there like a different type of feeling in your heart to make sure that?
Of course.
Yeah. I think always. I think when you come across a black patient, you just think like you just have to be extra careful, extra vigilant for them. Always make sure like they're understanding what they're being like it's being said to them. I'm always like trying to make sure we build like a good rapport so that they feel free enough to ask me these questions. Definitely because being black myself, I think you just think if it was me on the other hand, I would want my midwife to be that extra attentive to me. So I think I do, but probably not consciously, but I think it's just something I just do.
I think just because culturally as well, you can just relate a little bit better. I think sometimes white people might not always understand a black person's point of view and how they, let's say like pain, for example, like
pain threshold thing.
black people react differently to pain. Like we know that they do certain things, like our moms do stuff like this all the time. A white person's not always gonna understand that. So sometimes when you are black and you do get it, you relate to them just a little bit better. Obviously, every patient is important, but we can never ignore that, black people are the ones that are more likely to die. So you do feel that little bit of extra, like, okay, cool, like I've got to make sure.
Be more attentive.
Like make sure this woman understands and feels safe. And
Okay.
I still think that 4 times thing is crazy.
It's
crazy, man.
But I do feel like it's our generation of midwives that's trying to make the difference, because the older generation of black midwives, I don't really feel like could they try.
Do you know what? I've heard this.
I think as well. I feel like, especially when we were training, we just started, I feel like there was the minority. It was like there wasn't that many black midwives. I could count on one finger. One finger, one hand. How many black midwives were at the trust when we started training? So I think because there wasn't so many of them, it was like you just keep quiet and do your job. You didn't want to come out and then now everyone else is looking at you. I think it's more of like just making sure you fit in your workplace almost, and you just come do what you're supposed to do and you go. Whereas now there's so many more of us here, more of us training. It's like there's more of a backing, I think. So I think that's why. And I feel like also us, we don't take it quiet these days. I feel like the generations coming, we're more proactive in that voice.
We've got fire in us.
Whereas my grandma or something, or my mum, like back in the she'd be like, if you don't like it, it's okay, just do your job and come home. Like, don't mind
they enjoyed a lot more than what we would tolerate.
I think I'd say like the aunties of the generation, I feel like a lot of them are also still stuck in the ways, because even though part of the statistic, the reason why that statistic is there is not just because of the system. There's a lot of, contributing factors. And I do think that the aunties and the older generation are contributing factors, because sometimes they do pass down dangerous advice that they've learned from Africa.
What dangerous advice?
And they think like it's okay. Things, for example, like let's say like reduced fetal movement. So we always say to come in when you feel like your baby's pattern isn't the same, or baby's not moving as much as it usually does. And, a lot of aunties, like sometimes even my own mom, she'll be like, oh, it's fine, like baby sleep. Baby sleep.
How do you know?
Like that. Or like even like the water, feeding the baby's water, like we advise not to give it water. And
my mother-in-law, please.
Bro. Do you know what I mean? So sometimes they are part of that problem, because they do pass down those dangers, and then they think, we say even with pain, our parents somehow think we have some superpower to take every single pain, they're against epidurals, and there's a lot of aunties that are against epidurals. No one gets a trophy
for being in pain. At the end of it, we're not coming to give you an award saying like,
I think sometimes aunties are just so obsessed with and stuck in their ways. Oh, in Africa we never had this, you'll be fine. But it's like, no, it's not like that here.
What's
I think
your
that's what it
off
is.
topic? Yeah, but what's your opinion about, like, you know, when you have a newborn and like that Africans do like the bath, like the first bath where they're like all dangling the baby and stuff. What's your opinions on that?
I mean, I think because it's part of the culture, like I wouldn't say no to my mum doing it because I haven't heard any like statistical research that shows that that's dangerous or anything like that. So I would allow my mum to do it, you know, just a part of the culture.
Yeah,
just
I hear that.
To keep them happy.
One time you just don't go into the room if you don't want to watch.
Yeah.
Obviously me, I just
Because even my baby coming, I'm just like, I don't know if I want that to happen, but it's gonna happen.
It's gonna happen. It's jarring, but it's gonna happen.
For real. But how did you guys, like, I know you've spoken about it on your pod, but how did you get into becoming midwives?
So I did an access to midwifery course. So I did like normal college route. I wasn't really feeling it basically. And then I went down an access to midwifery course. So it was basically, well, it was meant to be a year, but then it was during COVID. So it got cut down to 9 months.
No,
so
it's even better, no?
Yeah, it was actually better.
Yeah.
So it was like it was like a college, but specifically for like access course. So they had access to all different nursing, all different types of subjects as well. But I did my access to midwifery, and then I did my 3 years at uni and then qualified. Yeah.
Okay, nice.
My route was, I always say it's like quite traditional. Went 6th form, finished 6th form. I went straight to uni. Did midwifery, and then that was
so
it.
You always knew you wanted to be a midwife?
Yeah. Well, not always. Funny enough, I wanted to be a lawyer in secondary school. It's so different.
Yeah.
But as I grew older and I had to actually think about what I wanted to do, I wanted to be in women's health. That was my thing.
Yeah.
And then I discovered midwifery, and I was like, okay, this kind of fits what I wanted to do. So then I just went for it straight.
Yeah. Okay. And what is being a midwife like everything you imagine it to be, or?
It's everything and more in a good and a bad way. I love that we advocate for these women. You know, like when you have a shift and delivery and everything goes straightforward, it's nice, it's lovely. But you have days where the outcome isn't so great, or you have an emergency after an emergency, or a day where you're overly worked because we're short-staffed, and like a shift where you've delivered 3 babies, no break, you haven't even drunk water. It happens.
Is that allowed though? Like,
it probably isn't.
But what can we do? Someone's coming in labour. You haven't had a break. You're not gonna say, "Oh, well, I'm going to have a break." Like, you gotta do it.
Yeah.
You just gotta do it.
Because I remember when my wife was in, when she gave birth, like we were waiting for time to get a bed. But it's like the midwives in that hospital was probably just overworked that day. But we're on the other side, like complaining, but we don't know what's going on, like behind the scenes.
And that happens a lot. That happens, especially if you're on the antenatal ward and you just need a transfer to the labour ward. Sometimes there's either no midwives to take you, there's no rooms available, or that the walking. Sometimes there'll be a midwife, and as soon as they're like, "Oh yeah, go get this patient," someone walks in. And they're in labour, and it's like, okay,
you gotta
now
wait
you're delayed because this person is in active labour. The demand is a lot.
I think when women, like, I'm assuming like came in through like a triage. So I think when everyone comes in, they just think, well, like there's like 2 people here, like it can't be taking that long. But then people forget that we have people who are already in hospital that might go into labour. People coming from triage that are coming in. People that absolutely weren't doing anything, and then all of a sudden
they've cracked on.
So it's like there's people coming from literally so many different points. So I get it. Like I wouldn't want to wait either, being a midwife myself, but it's frustrating, and sometimes that's the downside of it. Sometimes because sometimes people do get like super
really
aggressive with us, and it's frustrating. It's like I can't do anything. Like I literally can't. I can't do anything.
Where you just gotta pray that when it's your time, everything it's true. But remember, because even my first, what happened? So it was like I think she was contracting from like maybe like 4 a.m. I woke up at 6, so I contracted. Then we went to the hospital at 9. Got there. I think she started like I think she went from like a couple centimeters to ready between like 1, like so 9 and 1. Then I think she went from like active labour. The pushing started at like 5 o'clock. Then a couple pushes and it was done. So we had a short day, and then we were out the next day. And then Amari, so recently, so obviously this was Boxing Day. But we went into hospital at like 10:45. He was here at like 11:49, and then the next morning we got told to get out.
Like,
You're good now.
Yeah, we're good in it. Like, obviously, you know what you're doing. Just go home in it, and then
Yes.
So I think it just depends, but I think maybe it depends on the different hospitals as well, because I don't know. Because first Malachi was Queens. I liked Queens Hospital though. Queens was really good, and I think we had a student midwife and a normal midwife and the 2 Asian women, but they were really good and attentive still.
Yeah.
And obviously me, I was like, oh no, I want a black person. Who's a black person?
I feel like
I can't lie, I don't know. You know?
No offense, but to you guys, but I feel like I'm scarred by black midwives. You know,
You probably had an auntie.
Bro, even the other day, we had a scan, Like, obviously, it was our gender scan. We've already known the gender because we're going to private scan first. But even just the way, like, just so cold, like, I didn't want to smile. Like, just, like, she even got onto us because we asked her a question. So we must have asked her something. Then she was like, what do you mean? Like, Papa's getting onto us. Like, we were just like, whoa, like.
It's the way they're stuck in their ways. And, like, you know how they are, like, even the way they speak to each other sometimes, like, they forget to leave the attitude at home. I think with aunties sometimes, like, they bring it into work, like, everywhere they go. Like, I remember before I became a midwife, I used to be a nanny. And I remember even when I was talking to her about her birth, and she was like, you know, we have stuff like called hypnobirth, where and sometimes people use like a comb, whilst they're in pain. So whilst they're contracting, they basically like squeeze onto the comb, or sometimes people like squeeze onto like a spiky ball because it basically gets like, your brain thinking, okay, the pain is somewhere else, and it sort of focuses on the pain in your hand instead of like the contractions. So she said that she was doing that. You know, these African aunties, they don't really know, they don't get with like the new, you know, hypnobirthing and all of them things. They just think you go to hospital and see what you got to do. And she said that like she was using it, and she said the auntie literally took it from her and said, forget about this thing, like you don't need this thing. They're just stuck in their way. And I was shocked. And I was like, what, how did you react to that? She was like, because it was an auntie, like I understood.
That's like me.
But then she was like, I didn't want to disrespect her, but she was like, at the same time, I was thinking, that's a bit mad. Like if you did that to like a white person, they'd go right and complain about you. Like, you know,
my wife was even like, we should be complaining, because even like when you print off the scan pictures, she just dashed on the bed. She's like, yeah, take it. I just turned her head. I was like, what did I do? You know what I'm saying? But she was gonna complain. But I was like, it's auntie now, leave her. Like, do you know what I mean? So.
And that's what we do. We give them grace because they're aunties, and we're like,
because there's a certain attitude you have to have in this job, and that's not right.
Not on,
like even when she told me that she threw the camera, I was shocked. I was like,
that's
what?
crazy,
I would never dare.
I could never dare ever do that.
To us, we've had one that's black. She was a doctor, I think. I don't know what they're actually called, but so when my wife was in labour, she had an emergency C-section, but the black midwife was like proper advocating for her, like, she didn't want her to go through that, she wanted her to do natural. So when she was like, she can do it, everyone else was like, no, C-section. So she was basically trying to like prevent that from happening, which was good. And I feel like if she went there, they would have just rushed her in straight away. So at least she actually tried to help her, do you know what I mean? So which was fair enough, but we'll see what happens, Sha.
I don't know, we'll see what happens. You pray?
Yeah, I was going to ask, are you going for a cesarean?
I don't know. We're having that conversation. Like, she wants a natural with this time, but I'm just like, you know, Demas, whatever you want, babe. Like, like, what's your advice on that? Someone that had a C-section before.
How far dilated did she get last time?
I can't remember.
To be fair,
that birth story, I pushed that to the back of my mind. I don't know anything. I can't remember anything. All I remember was in a labour ward. I went in there. I'm putting on my hat and everything. That's all I remember. But I can't remember how far she was dilating and stuff.
I think, so obviously there's different contributing factors. That could obviously tell you whether, you know, what's the better decision to do. Obviously, you can always try for a vaginal birth after cesarean section. Like, they will always give you the chance to do that. So if she dilated, let's say she got into active labour, it's very likely she'll just get into active labour again. Second babies usually come very quickly. Like you can attest to that. Second babies just they come quickly. Second babies come really quick, so it's actually a good time to try and attempt. I think, but I do think they always offer interventions quite quickly when you go down that route. They have a very low threshold to take you into theatre for another cesarean, just because of the risks that are associated. But you are allowed to you are actually allowed to do whatever you want.
Yeah, it
Yeah.
is your,
Yeah.
your baby.
My thing was
you're
like,
like,
you're
just
actually
the
allowed.
safest way.
Do the quick.
Yeah.
The safest way. But
Yeah.
it's her decision. So.
No, it is.
Yeah.
Whatever
I
she's
think-
happy with.
Yeah, having a vaginal birth is absolutely fine. And we see loads of women do it
Loads.
time
Yeah.
after time. I think it just depends how far she
Yeah.
went. And the
Yeah.
scar tenderness is what they
Yeah.
worry about and
Yeah.
stuff like that. But if she feels okay and if she's laboured before,
Yeah.
she'll be
Yeah.
right.
Yeah.
It should be
Yeah.
alright.
Fairs. But I think one of the main reasons why I want to get you on is obviously we want to talk about from like a male's perspective on how to support your partner when they're during pregnancy
And in the labour room.
and in the labour room, because obviously a lot of the time, I think for me, for the first baby, I was very like, because it's your first, innit? So you're very like attentive, like
Yeah.
you're looking at like
Yeah.
I was checking. I forgot what the app's called, the baby app where you can see what they're growing, what size.
Oh,
I've
it's
got
like-
the size of
Yeah.
the baby.
Let me tell you the app.
Baby buddy, it's baby buddy, does it?
I don't even have that one.
There's
I've got
Baby
Pregnancy
Buddy-
Plus.
Yeah, see, there's a couple. So it's, I was looking on that every day to see,
It's
oh,
very exciting.
it's the size of a
Yeah.
melon now, etc., etc. Then for my second, I was just like, sometimes I'd forget.
coasting
Just,
through
like,
it,
just
man.
coasting through.
That's me
I
now.
just forget, like, oh, you are pregnant,
Yeah.
but obviously because I'm looking after a toddler at the same time,
Yeah, you're
and then
busier.
we're
You're
busier,
busier.
so when I'm not that attentive. But I think,
But do you feel like your second pregnancy just goes quicker?
It just went quick,
Because
bro.
our second pregnancy, bro, I can't remember, like, the beginning to now has went quick.
Yeah.
So I literally, I hear
but
it.
I think it's because we're looking after children at the same
Yeah,
time.
yeah,
You just,
yeah. Time
you know what it was?
flies.
You just want your day to quickly go, so you
Yeah,
go to
yeah,
bed,
yeah.
you recharge, and go next
Yeah,
day.
yeah,
innit?
yeah.
So I think the main question is, in terms of like when you find out, so maybe first trimester, let's say it's first trimester, what you've just found out, you're like your partner's pregnant. How do you make sure that they feel supported in that time?
I would say first trimester can be tricky. It can be very straightforward for some people. Some people have morning sickness, heartburn, all these things. But in terms of being present, I think obviously attending all the appointments and the scans, I would say just asking them what they need from time to time and trying to keep yourself, like you said, the app, you're checking what size, see what you can do. But from this week's, like baby can hear us now. So like trying to talk to the baby, just inserting yourself in there to feel, even though she's carrying the child, to feel like you are there, I would say, in first trimester especially. And obviously her body's going through a lot of changes that trimester.
Yeah.
The hormones are changing and everything. So
They sleep a lot as well.
Yeah.
it's because
They can't, pregnant women can't sleep.
the baby's literally taking everything from them.
Yeah, I hear it. I try to
Taking
give
your
her more
blood,
grace.
it's taking your oxygen, it's taking
I hear it.
everything.
Making
try
sure
and give
they're
them more
fed
grace.
well as
Yeah.
well, keeping them
Yeah.
like nice, nutritious food,
Yeah.
and just being there. First trimester.
Yeah, I think first trimester, like you said, it's quite difficult because it's just that the start. It's the beginning. You don't have a lot going on in terms of like the hospital side of things. So you have like a scan, like a couple of blood tests
about
and that time. So there's not much not much happens. But I think, especially if you're a first time, I think research is important.
Yeah.
I think just trying to be as clued up as possible so that sometimes if your partner is speaking about things, it's like you understand. Pregnant women are very irritable. And I'm sure
I'm sure.
I'm
Even
sure you guys
today,
know.
I asked my wife a question. She just got the hump for 2 hours. I was like, But she was like, baby, no, when I'm pregnant. I'm just like,
Yeah. Do you know what I mean? So I feel like being a little bit clued up so that when they do talk about something and then the fact that you actually understand what they're saying, it just helps a little bit.
yeah.
I think a lot of the time, like I said, they're irritable. So if they're talking about something, you're just like, huh? Like they'll want to just
Slap-
literally
slap
just
you.
slap you right there.
Yeah.
So I think being clued up and just trying to do as much research as you can in that time really does help. It really does.
Fair.
And then what about the second and third?
I'd say pretty much the same.
Yeah, I think the same,
Once you've like done your research and you know what's happening, third trimester, when you're talking to them about the type of delivery and everything you want, make sure you know the options. Go through
Birth
it
plan.
together. Birth plan, do it together.
Yeah, true.
Because
Hospital run.
exactly because when it gets there, also pack the bags.
Pack the bags.
Pack the
yeah,
bags.
I was packing them. Actually,
Pack the
you
bags.
know what? I wasn't as packed. I didn't pack what I actually needed.
What, the
Do you know
first
what I
one?
mean? Like, I didn't pack like in terms of like toiletries and stuff.
Yeah.
So you
I have to go
to
home and
pack.
shower. And
Well,
that.
The partner always has to pack the whole bag. As in,
I'm talking about my bag.
No,
I'm not talking about what I need.
My wife packed her bag.
no.
should
You
pack
need
the
to pack
hospital
her bag.
bag.
The
Oh, the
reason
husband.
why you need to pack
Oh,
her
because you need
bag.
to know where everything is.
Exactly.
That's true.
Exactly.
Because then you're like,
Because
where
when
is
they're
it? Where
in
is
pain
it?
It's true.
and they're
'Cause
saying,
she's
go
then
and
telling
get
me,
this.
I'm like, baby, where's your bag? It's true. You know what?
Exactly.
No, I hear that. No, I hear that. That's a good one.
Because common nappy, you're like,
Yeah,
oh, babe,
you're like,
what
where
did
would
you
you-
do? And then they get
And
fully
they're in
annoyed at
pain.
you.
Imagine
It's
the
true.
irritation is on 100. They're in
I-
pain.
I'm a dad. You know what? I'm a dad that I don't know about everything, innit? So like even her whole pregnancy journey, like I was telling her, babe, just tell me what to do. Like I didn't actually go and look at what I needed to do. Like even the antenatal classes, like, I didn't do it.
Oh,
I need to.
time.
Yeah.
next time add it to
We done the first one, but it was just so boring, man. Like it was on Teams. Or
When was
something.
this?
It was on Zoom.
The first for
Wednesday,
It's probably
yeah.
like a common NCT.
Why though?
It was on Zoom. I was just like,
there
bro,
doing antenatal classes,
turn this
bro.
off, man.
No, the only thing I didn't do was pack her bag, but she labelled everything, so I knew where everything was. So I just
fair enough.
singing, dashing,
Man said
and her
pack
mum
bag.
was there. Her mum was there for the first birth, and then even the second birth, her mum came and her sister came. So
They
there's-
took
there's
the
a lot
load
of-
of-
So you didn't have to do much,
Like,
bro.
bro, honestly, bro, after Mally was born, first night, bro, obviously her mum couldn't go home, so she stayed. I went home, I slept. That was the night I slept, bro. Then I came back in the morning. Second birth, her mum came again, but obviously we were in Dartford. They live in like East,
Yeah.
so obviously she couldn't go home.
Yeah.
I went home, I slept.
Okay, now I'll
Then I hadn't
definitely.
slept enough for the both of you.
You know what? Okay, I'll definitely pack
You know
the
when you
bag.
see the partner, you see like, just go.
Hey, can I ask a
No, you know what though? You know what? At the same
That's too
time,
funny.
though, it's not good for both of us to be tired, though.
Yes, but that's what we always
No, but
say.
you
Yeah.
have to at least she
I
looks
do
over and
say.
she sees you there. Do you know what I'm saying?
Nah.
I want to ask
My
another
mum's there,
question.
bro.
Why do you guys give us men? Well, not men, but the visitors or whoever's staying with the woman, like those uncomfortable chairs.
It's not about you.
Those chairs.
Okay, we don't pick the chairs. Oh yeah, we don't pick the chairs. But my thing
also,
is, if you
it's
didn't
not
have the
about
baby,
you.
you're gonna
It's
sit
true.
wherever.
It's not about you because I've never said it before. Yeah, like when my wife gave birth, they offered her toast, innit? And I was hungry. I hadn't eaten, so I was like, "Oh, can I have some toast?" She just said, "Nah, sorry." If you
No,
don't-
I for
always
both.
do it.
God bless you guys. God bless. Because the woman.
That one is
always do it.
individualized. Like
Because
that was
the
down to
bread
the
is not coming out
individual.
my
Yeah,
salad.
like,
That's
it's
what I
not.
said.
That's what I
It's
offer
your
it to
bread.
both. I'll just offer it to both. It's fine.
Bro, she was like, "Oh no,
Yeah.
it's just for the mums." I said,
No.
"So you've seen me here since. You can't give me toast."
You know what,
I
though?
be giving it. I don't
I
care.
do it.
I
I
just
don't
offer
even
both
ask. I
because
just
I
do
know
it.
men are always hungry. I'll just be like, "Do you want some as
Right.
well?" You know, some of them are a bit
Wait,
shy. I'll just be
yeah.
like, "Do you want some as
Even
well?"
tea,
Yeah.
they'll be like, oh, I'm not sure. And I'm like, you sure? Oh, yeah,
Yeah.
I want that.
Yeah.
Yeah.
Are you same hospital because of distance? Are you
Yeah, same hospital.
No, we're gonna
Yeah.
go do prayer meeting and fasting.
Yeah,
before,
same hospital.
because,
But I
bro,
like the hospital. Very
No,
good
I don't like the
hospital.
hospital, but obviously for it to be a better
Yeah,
experience.
yeah,
this
yeah,
family
yeah,
needs
yeah.
to
No,
make sure.
it was a cool experience. It was just the whole label.
Yeah,
Yeah,
exactly.
yeah, mad.
No, but okay. What do you guys think about men packing hospital bags
For
I think you should
themselves.
do
for
it.
themselves?
Oh, why?
Wait,
Right, yeah. No. What are you
So I
putting
need
in
my
there?
snack. I need my boxes. I need my laptop.
I need my laptop. I went to my Nintendo Switch.
But that's what I'm saying.
Wait, no, but I was still but when
but it's
she's
boring
there-
though. We're
when
just in a
she's
little
there
cubicle, bro.
sleeping, She was there sleeping for half the time. What am I gonna be doing? Just sitting there looking at the sky.
Okay,
I get that.
it depends on the stage that you're at. It depends on your stage. But packing a whole bag.
No, but you know that's what I
Yay.
didn't pack what I actually needed. I packed the fun stuff.
I packed sweets, I packed laptop, I packed Nintendo Switch,
literally.
I packed tracksuit, I packed
Bro.
slides, I said,
And you left your
Yeah.
toothbrush at
I
home.
I had to go to the shop to get it. Then to shower, I had to go home because I had nothing.
yeah.
But I'm here with my suitcase of just game. But yeah,
Because you guys are the ones that's making it like you're going on holiday.
Holiday.
Coming with the big suitcases and the bags. Like, no.
Yeah.
Why? We want to feel part of the experience too.
but in terms of like men being in a labour room with their wives or their partners, like what do you feel like they need to do to help, and what should they stop doing?
Stop watching football.
Yeah.
Thank you.
Please, that
No,
one.
it doesn't matter.
Stop
who's
watching
playing.
football.
Yeah.
Stop asking.
I disagree with that. Okay, cool. Let me ask you a question.
So much verbal.
Can I ask you a question?
Yeah.
So her label took quite long, yeah?
Okay.
So we were just chilling in the room for a long time. So in that moment, I can't watch the game if it's on.
Yeah, when that's happening, cool. But I've literally had couples where she's now pushing, but because his team is playing, he has the football on.
Oh, that's crazy.
Yeah,
that's crazy.
And then he's like, "Yeah, you got this, babe." And you're watching. I'm like,
it was the
let
day
my
of the
husband
World Cup.
try.
The day of the England World Cup.
Yeah.
I
No,
saw
you know
the
what?
best partners in the world.
Give him grace now.
That's
That
why
day
it's
England
4
was
years
playing.
now, man.
I said,
Wait, what happened?
You
What happened?
this is the worst. But
What
just
happened?
how long is this gonna be? How long is this gonna be? How long is this gonna be?
Yeah, because the game is
How
on.
long is this gonna be?
And, no, but what you're seeing there is what you'll see after the baby's born. Uselessness.
Thank you.
At least, I know, but
Get
at least
people
they're
like
there.
that.
No, they're
Some
not
man
there.
watch the game
No,
and come
I'm
back.
there. You might as well not be there.
That's what I
Yeah.
think.
Might as
If
well
you're
not
gonna
be
be there and be useless, just
Go
go
home.
home.
That's
Just
what I
go
say.
home. Yeah.
If you're gonna be
There's
there,
no
be
point.
useless, just go home.
Because you're gonna
You're not gonna
irritate
add
your wife.
anything.
You're gonna irritate
Yeah.
your partner. They're gonna get annoyed,
Yeah.
and then now they're in pain, and now they're also annoyed at you.
Yeah.
And it's like it's supposed to be a beautiful experience.
Yeah.
I think, especially in the stage where they're
Yeah.
pushing, forget everything. Be attentive to them. Hold their hand.
Yeah.
Offer water.
Don't be in extra
Be
stress.
holding the fan. Like be
Yeah.
Give them a
there.
massage, small back massage.
Even if they're
Yeah.
cussing you out,
Don't
be
be,
nice.
don't be
Be
stressed.
nice.
Don't be
Exactly.
stressed. That's my number one advice. Like that's what I say to him. This is why my unpopular opinion is that the father of your baby doesn't always have to be your birth partner. You can honestly pick anyone. No,
Damn.
no, no, no. I say
You
that.
also got her mom?
Like her mum or her sister.
But I
But
have
the
to be
reason
there,
why
though.
I say that is because some people have partners that are queasy, one side of blood.
Yeah, true.
I've had
Oh,
partners
No,
who
because
say-
I can't lie, though.
And I'm like,
People gag.
No, I can understand.
In the room.
No, I can understand
Yeah.
because I went to look one time and I was
Who asked you to
no,
look?
no,
Because me, I always say stay
No, because I want to
behind.
see. I'm present, bro. I need to
You would
see
see.
everything, man. So I went to see. I just saw. I said, "No, that's a fairs, man." But I understand why people would faint or
Yeah,
be
I've
queasy,
had
but I'm
people
not like
faint
that.
I went
People
to the, I
think
went to
be
the
queasy.
bathroom to like psych myself up. Then I just got out all the
So if
emotion
I
in the
said in the mirror,
bathroom.
"Ma,
I was just
ma."
like,
Yeah, literally.
and then I
But
came
you
back.
have to be like
Yeah.
that. And sometimes you get like partners that are more anxious than the lady that you're anxious,
Yeah.
she's
And
anxious.
that's
yeah.
the
No
vice
one's
versa.
making
No.
anything
What do
better.
you think about partners that like are trying to do the advocating thing, but they don't really know what they're talking about? Like,
See
how
that
do,
one?
how do you deal with
Just
those
do
kind
it
of
for sure.
guys?
Gonna get in trouble
Hey, got it, man.
because we get so many
Yeah,
of
yeah.
those that they say something. I'm just like nothing
shut
you
your
said
mouth.
didn't make
Is
any
it?
I feel
sense.
like women
did you
should have a
do your
script for these
yeah.
men. I feel like there's a,
Yeah.
and then
You
just
do get-
take it out and be saying
Literally,
it.
Yeah.
you get amazing partners that know exactly what they're talking about. Like you can tell they've done their work.
I was
And
there.
you
I
just-
was one.
You get
give that.
some
That
that
man
yeah.
attended six, man. I was
You
there.
know, with me, I didn't know much, so I was just mainly asking them questions like, "Oh, so what does this mean? What's happening
And that's
now?"
fine.
I just
That's
ask questions.
absolutely fine.
I'm not going to advocate something I don't know.
Yeah.
You know what I'm saying?
But that's why it's important to do your research
Yeah, this one I'm
beforehand,
gonna try.
and then
Because
be
I'm-
given.
I'm giving
Yeah.
like I don't really care, but I do. It's just that with certain things, I'm just like,
You'd rather
just
I think
yeah,
quiet
it's because
then.
it's your second,
Yeah.
Yeah.
and you know how to parent anyway.
yeah.
I think that's why you're more relaxed.
Mm-hmm.
However, I do think this one, make sure you know. So when you're there,
Yeah, I
you
know. What to, yeah.
and you know the birth plan,
Yeah.
everything. So
Yeah.
you know
In
what's
and
going
out,
on.
Yeah.
literally.
Yeah. So
know
what did if you think of an example, what did that person do?
like. Do you know? I think it's more to do with them. Like sometimes, like they don't understand like the language, or like you know, like when dangerous situations are happening and they're not understanding like the magnitude of what's going on, and then they just say something silly. Like for example, I've had like women. Obviously, everyone has a birth plan. Everyone has a birth plan. You come in and you say whatever you want to happen, right? So I had this lady one time who had like I'd say quite a very strict birth plan. A lot of them you get like really strict birth plans.
On their end or what
On
you
their
guys have
end.
given?
On their end.
That how they
Very
want it.
well
On how they want.
They've printed. Some people laminate
Yeah.
everything, and they give it.
Yeah, they want to be in the pool. They want this.
Yeah,
they want that,
yeah. Things like
Like,
that.
some
Yeah.
people don't say it's contractions,
Yeah.
it's surgery.
Yeah, you're not allowed to say the word pain. Like they will change the word for you. Yeah, so
So they even telling you what to
yeah,
say.
some of them
Yeah.
they have really strict birth plans. So anyway, this lady had quite
Okay,
a strict.
we could cut this out, but what sort of ethnicity?
That's what I was gonna ask.
Right.
Yeah.
There's always them.
Yeah.
But yeah, so then we had this lady, so she had obviously come in. So she had a plan, so she didn't want the baby to be wiped once the baby was out.
Okay.
And that was fine. Like, so obviously when there's an emergency, things have to change. So obviously her baby came out, and her baby came out quite flat, so wasn't breathing. So one of our first things that we do when a baby comes out flat is that we stimulate it by basically wiping it down to try and get it. So we obviously that was our first thing. Not like when that happens, I'm not thinking about your birth plan because I'm thinking I need your baby alive. I'm not thinking about your birth plan. So I started doing that, and the dad was like, on our birth plan it says not to. And
Can you honestly, see that the baby's not breathing?
I literally just had to be like, because I was like, what are you even talking about right now? Can you not? I just don't. I just don't.
Yeah, that's what I do.
I just don't. I will do what I need to do, and then I'll explain to you afterwards why I did what I did. But in that moment, there's no time. It happens so fast. Quick, you have to move very quickly
fast,
when a baby comes out flat, because every literally minute counts. Like even when we do resuscitation, you have to do it for a certain amount of time. You have to check the heart rate, check if they're breathing again after a certain amount of time. So there's no time to be dilly-dallying. I don't have time to stand and explain to you why I'm wiping the baby, even though you didn't really want me to. But it was just in that moment, I just thought, you don't even know, like, read the room, you don't know what's happening right now. So things like that, and I think obviously his partner recognized what was happening, which is why she was not saying anything. But I think he was trying to advocate for the birth plan, but he wasn't reading the room. He didn't understand
What an idiot, man.
what was going on. So I was just like, we were literally just, I was like, this guy can't be serious. Like, can't you see that your baby's like not breathing right now, and you're asking me not to?
And then I've got one in terms of advocating, just what you said. There's people that try to advocate and they're doing really well, but one way I've seen an epidural, obviously the woman has said, babe, I don't want an epidural, no matter what happens, don't let me get one. And I've seen it and I hear it, fair enough. Initially, she doesn't want it, but this woman is in pain. They're crying, they're in so much pain. They want an epidural, and then the partner goes, no, you're not getting it, you're not getting it. She's not getting it. She said she didn't want it, she's not getting it. And I can understand she's told you that I didn't want it, but now the circumstances have changed. She's in agony. You can just see when they're contracting, tears down her eyes, she's crying.
Are you allowed to listen to the man though?
No.
Yeah, you're not even allowed to listen to them.
But then they're standing over the woman, and then she's like, no. And then she's a bit fearful, and then eventually she was like, I think I just want it. And I kid you not, during the process of it, the man stood at the corner of the room, sat down like this the whole time. He looked fuming that she got an epidural. But I'm like, she's in pain.
This is life or death situation, bro.
There's like a risk of like being paralyzed or something.
There is, but it's a very small risk.
Tiny.
It's like,
it's a tiny
I want to say
risk.
one in like 10,000.
I've never seen it in my life.
It's very, very minuscule. And I've never seen it
or never heard it happen.
It's something they do, like these anaesthetists do it day to day. Like some of them will do 10 per shift. Like it's a big thing individually. But it's something they do often. Exactly. And also once you do your research and you know about it and you weigh out the pros and the cons, it's more beneficial than anything if you need it. But I just felt really bad because I could understand you're trying to advocate for her birth plan, but she was like, you know, when you look at a person, she's like, and you can just she's in pain, like she's in pain, like. And then he was mad at her for getting the epidural. So like for like 2 hours after, he barely said a word. He's just sat in that corner, and I'm like, that's damping on her experience.
You get people
and now
like
she's
that.
gonna feel bad for making herself feel better because she's got an epidural. But it's like,
Right? Sorry again, we'll call it a white person,
no, black,
Damn.
black couple.
Even though you know the risk of 4 times more and all of that, you don't want her to just
some of them.
They were quite young.
Some partners are very mad.
He was fuming. When I tell you for the process, he was just sat in the corner, didn't hold her hand, nothing.
You know when they do that, me as well, I ice them out.
Yes,
I will turn my back. I'll be like, I'm
can play the game.
because you're not gonna come in this room and create that vibe. Like, this is meant to be a positive experience.
Exactly.
Like when partners do that, I just ice them out. I'm just gonna ice you out because
at the end of the day, you're not my patient.
You're not my
more
patient.
times
the woman that
partners do this like
Some men are a bit
I don't
weird.
think you
still.
understand.
Some men
I
are weird.
personally think, in my experience, is men that ruin
the birth
experience.
experience.
The men that ruin it.
Yeah.
That's what I would say. Don't get me wrong. Sometimes you do get difficult ladies, like you really do. But at the end of it, they realize that they're in your care. So sometimes they start off difficult, or sometimes they're in pain. So that's why they're being a bit difficult and they're being a bit rude because they're in pain. But then they're like they're the sweetest people ever. But it's the men. the men ruin it for me. I say it all the time. They ruin it. I've had terrible men like that come in and they're just horrible, aggressive. I've had men like literally hands in my face, doing all this, swearing, effing, blinding.
But
everything.
you need me now.
Exactly. But
And that's why I say, you know, people, they don't feel something. I'm thinking you're in my care. Obviously, not that I'd ever do anything dangerous, but it's just like you're in my care and you're being horrible to the person that's caring after your partner. Like, that literally makes no sense.
And then after we're all sitting in the same room as well.
Like, and obviously you get all different types.
So a guy's been moving mad all day, but the baby comes and everything's like bliss, everything's cool. Do they change or are they still weird?
Some of them are still.
People,
you see, me, I'm security. Or me, as soon as you start as a security, because I'm not going to deal with it. I'm not. Sometimes you have to be in that room for a whole 12 hours. I'm not going to deal with someone like abusing me for the whole 12 hours.
Oh, that's
so
crazy,
I'll literally just be like, listen, I'll just call security. We'll just cut it short.
Yeah.
Like,
And
I'm not here to argue with you.
Yeah.
I'm here to make sure your wife and baby are safe. I'm not here for you. So if you're gonna do anything to, make this a very negative experience, I'll just call security.
Yeah.
Oh, that's disappointing. I'm sad to hear about that.
Yeah.
What's your opinions on like the remedies of like to bring on labour? So like
raspberry
teas and like what do you recommend?
Curb walking. I curb walk.
So
Do you feel like they're just myths or they're actually like
all of them are just recommendations / myths. The only thing that's actually scientifically proven to help with labour is dates, eating dates.
Oh, is it?
That's the only thing. That's the only thing.
Everything else is myths, but some people it works for them. But I think it's a placebo thing.
Yeah.
If you think it's gonna work, it's gonna work. So like some people swear by raspberry leaf tea because they drank it however many times and it worked. Yeah. And there's some people that are like, drank it, nothing happened. People drink okra water or whatever.
That's slimy.
Yeah.
I heard that.
Like I think they're all myths. But if it works, it works. But it's very different, like it works differently on everyone else. But dates is the only thing we can say.
Dates is the only thing that we can say, okay,
actually,
like this is proven.
Yeah.
What, dates?
Yeah, eating dates.
Sure.
It's the only thing that's scientifically proven.
Is it?
Yeah.
What do dates do?
I have
Apparently
no
it
idea
helps
what the
bring on
correlation is,
labour.
but
That's crazy.
Some people put peanut butter on it and then apparently it tastes like Snickers.
Yeah.
So you have loads of
I need to
women
verify that for the missus.
so yeah,
literally.
And then with that, how can women prepare better for labour?
Yeah.
I'd say it starts up here. I think a lot of women focus on the physical part of labour. Oh, I'm going to be in pain. I want to push 3 times. I don't want to tear. That they forget about preparing themselves up here. And I think a lot of people also, I'd say, stay off the TikTok stories.
Yeah.
What's that app called? Peanut.
The way the women are just uploading.
Yeah. I'm like, bro.
Just stay off it because everyone's birth experience is completely different. Like, it doesn't matter how much similarities you guys have. Like, it's never going to be the same. Even your first pregnancy and your second pregnancy, your first birth and your second birth, it's never going to be the same. Like, you might think, last time this happened, but it's honestly, it never runs the same. So I feel like women always need to prepare themselves mentally. Like, you have a lot of women that come in and they're like, okay, I just want to breathe my baby out. That's all I'm fine. You can come and do that, but they prepare themselves so much for that type of delivery. Is that when they come in and things start to go a different way, they lose control and they panic. And that's it.
True,
You have to make yourself aware of, mentally up there, of all the options of what could potentially happen. Have a birth plan, absolutely, because then that gives us an insight of what you want.
Exactly.
And it shows us that you've read and you've looked into the type of birth that you want. So do that. Have a birth plan, but mentally prepare yourself for things to go another way.
Be aware of your options. I'd say look into all the types of deliveries, and also that's how you can advocate or negotiate better as well. If you're planning for a vaginal birth and they said, you've been pushing for so amount of time, nothing's happening, let's go have a C-section. You'd be like, actually, I read about what we call a ventouse delivery, which is like a little cap on the head that helps. So it's like, can we do that instead? Let's meet halfway. Whilst I push, you put it on, you pull. So it's once when you know the types of deliveries you can have and you know what your options are, you can better advocate for yourself. And also when they know it's like
there's a switch.
exactly.
They'll know this one I can't mess around.
Exactly.
A lot of the
Because
time,
they're human as well. Sometimes they've had a long day and the doctor's thinking, you know what, if we just do a C-section, maybe I've got so and so and so. You just never know. Obviously there's circumstances, maybe there's concerning factors, but those situations can happen. But if you know and you're actually, let's try this, let's do that. And I've had women that have done that, and some of them it's turned out the way they wanted, and they're like, see, if I did that, I would have regretted it. And it's just literally, knowledge is power. Like you have to know.
You have to know
to be able to discuss these things as well, because at the end of the day, it's your care. You're in charge of your care. You can't let anyone kind of dictate what you want. So if you know, then you can go back and forth until you get somewhere that you're happy with.
Knowledge is power.
I'm going to research.
Please.
It does start.
I have a few months
It
left.
does.
But bro, I can't lie. Even I didn't know about the cup thing.
There's
crazy.
different types of instrumental deliveries that can happen.
More time, it kind of just seems like
it's just one way or the other.
Honestly, it doesn't seem like there's no other
ways.
And then I had a last question. It was mainly about like postpartum. So obviously, postpartum depression is like a thing that a lot of women go through. I wouldn't say my wife went through it. She kind of had little bits here and there sometimes. And I think how as men can we support our partners when they're going through something like that?
I think with postpartum depression, I think a lot of the time where partners go wrong or they might misunderstand postpartum depression is because sometimes they're like, but I'm here. But you don't understand that when a woman has a baby, they've had the baby, they go through all the hormonal changes. Like their baby most relies on them if they're breastfeeding, for example. The baby's relying on them. It's a very lonely experience. Yes, you can have a partner there that's very present, but pregnancy alone, it's a lonely experience. And even after birth as well, it's a very lonely experience. I always say to partners is help where you can. Like, I think even as a lot of the time, even in the culture, sometimes we're so obsessed with splitting the responsibilities. Or I can't clean because I'm a man. I can't do this because I'm a man. But you have to be able to pick up some of those responsibilities when your wife does give birth, and you need to give grace.
You
need to give grace, especially when it's first time. Like you need to give a lot of grace. And women, all they're thinking is, I need to make sure my baby's okay. I need to that they forget about themselves. Look after your wife, Sha. Look after your partner. Sometimes they'll forget to look after themselves.
And they do. They do.
So I think just not just being present, but actually doing things, like being proactive, like actually being there for her, asking if she might want it. Sometimes women, they're with their babies all the time that they even forget that they might need someone just be like, should we go out for a meal? To actually be like, oh wait, I haven't actually been out for a meal in ages. I haven't even eaten today. Actually, let me, because they're just so like on the ball, making sure the baby's okay, baby's okay. And sometimes it's a partner's responsibility to take them out of that space sometimes, because that's all they're gonna be on. So it's important that you try and take them out of that space.
Definitely look after them. And then I will also say, you partners are most likely to notice any signs of postnatal depression and anything. Like, not necessarily, your partner might not necessarily notice themselves. Like Koja said, they're in that space of just need to look after baby needs to feed, baby needs to do this, I need to do that, then I need to clean the house, then I need to cook. Like, they might be showing signs they won't recognize themselves, or you're with them all the time, you will notice change in behavior. So when you notice it from early, it's kind of down to you to try and do something about it. Don't think maybe she's just in a bad mood or she just had a baby. To do something about it before it gets to a stage where it's gone a bit too far. And if you feel like it has gone too far, like, offer them help in terms of if they need help outside of you, like you be open to that. Especially us Black people, we're not very good at using resources. We have midwives that are specialized in mental health, like they're called perinatal mental health midwives, that can actually be involved in the care. So if you feel like your partner is, suffering from postnatal depression, or your partner thinks that they're suffering it from themselves, you can actually self-refer and get
specialized midwives to come out and see you and just give you that extra help. Because if you don't, a lot of our midwives, we see you like after like 10 days and it's like, bye. But they can stay longer. You can have people that can come and see you a little bit more, that can invite you into their clinic a little bit more, just to make sure that you are okay. Us black people especially, we don't like reaching out for help at all.
We want to do everything on our own.
Even during pregnancy, we have specialized teams that specialize in people that have mental health issues, that have past trauma. Even if you just had past trauma from your birth, you can be asked to be referred to a specialized midwife that comes and sees you a bit more, gives you more appointments, for example, and just a little bit closer to you.
Just to have
someone to keep an eye.
Just having that extra. It's a big thing throughout, because sometimes the delivery alone is traumatic, and then I think our knee-jerk reaction is just forget about it, push it in the back of your mind, forget about it. But actually that would lead into it embeds itself in other situations. So it's important to, if you have a traumatic birth, get a debrief, get the team to speak to you, understand what happened, why it happened, process it, and then move on from it. I feel like we're so quick to be like, oh, it's happened already, whatever, push it in the back of your mind, try quickly, like, press it down, move on, and then it just embeds itself and then can create other problems. But just use the help available if needed, but you can help them by being present, being supportive, and just letting them understand that it's okay to not be okay. Like it's fine. Like your body, the hormone levels are changing. It's crazy what things happen to a woman's body during this time. So just being there and be like, babe, if you're not okay, that's fine. Take the day off. I will look after the baby. Go to your mom's. Go get your nails done. Go get a pedicure. Just go walk around Westfield if you want. Just you know, anything to just get 5 minutes. Just clear your mind. Just to breathe and be like, okay, this is fine.
And sometimes moms do. I feel like sometimes they do forget to insert the partner. Sometimes I don't think it's always on purpose. Sometimes I think because they're let's say they're breastfeeding, for example, so baby's always feeding on them, so they're the main person. They forget it's okay to insert yourself. Babe, can I have just 5 minutes?
Or if you pump, I'll do the next feed. Things like that. Just to give them a break, make them feel like, okay, even though it's them, you're really trying to be there. You're there.
And I do think as men as well, obviously, I know some of us go through that little thing of it's now always about baby, but at the same time, I think as men we've got to realise someone. This baby's it's only been in the world for 2 weeks.
Right.
You don't know anything. It's not about me right now. I just need to make sure we go.
I've deeped it. It's actually not about us.
It's not about
you guys are just the paid actors.
No, for real.
So I think it's definitely maturing on the man's part, but I think as well we're just there. We're supposed to be helping you this time, bro.
Whatever you want me to do, I'll do it. Do you know what I mean?
Also, ask the questions. Ask the questions. Ask them.
Okay.
Ask them questions.
Ask your partners the questions. Like, are you okay? Like, not just, oh, baby, you okay? Like, are you okay? Like, mentally, physically, emotionally. Like, sometimes just sharing, talking to someone, it just helps lighten the weight a little bit. So, like, proper having that time, sit them down and have those conversations.
No, 100%. And as well, obviously, thank God that some of us, our parents can come and support, etc. Like my mum-in-law and my mum, they were swapping shifts for like a good 2 months. Just constantly, someone was always there helping, which was a lifesaver. Especially for your first, it's a lifesaver. But it's definitely, it's the maddest experience that anyone can go through. And even us,
it's underestimated.
Like it's mad for us as well, but for a woman, it's crazy. That's why I say you can't just have a baby for foolish men, bro. Because some of these men that are in the...
That's the first thing I say to all my friends. I say, this baby thing is not small thing. Don't go do it for small boyfriend. You're going to regret it. How many people do you see in this generation that have babies and when the baby's out, not even a year in? Because it's a massive thing.
No, it's big.
No, I agree.
It's literally a lifelong commitment.
During the second birth, obviously, Abby's sister was there, and one of her sisters were there. And I looked at her, I said, look at what she's having to go through. You see I'm serious? I'm patterned. Don't go and be doing anything for any silly man. Look at what she's going through right now. It's
It's not easy. It's not easy.
It really isn't.
It's crazy.
It's a huge commitment.
No,
lifelong.
Huge
Yeah.
commitment.
No, yeah,
Yeah.
absolutely.
Lifelong. You can't go back to hospital and be like, can you take the
the
baby
baby
back?
back.
Yeah, no
Change my
cap.
mind.
Yeah.
Literally.
No, no cap,
We
man.
have to.
It's
gotta
not.
do
Hey,
it.
guys, thank you very much, though.
Yeah,
No,
no, thank you, man.
definitely
Open my
need it.
eyes still. Now
No,
I need to know.
it was
I need to go and pack
especially
my
for
wife's
you.
bag now.
Yeah. But if you could just tell people, like, maybe give a bit of like a quick background about your pod,
Yeah.
where they can find you, and then so then we'll just tag and everything like that. And
So obviously we're the Delivery Podcast. We're on Instagram, TikTok, YouTube, and Spotify. So we are with 2 E's Delivery Room on Instagram, and we're the Delivery Room Podcast on TikTok. That's the same for YouTube as well and Spotify.
Yeah.
Yeah.
And what a bit about us?
Yeah.
We talk about maternity, pregnancy, labor, birth. We bring stories in, and like we said before, we just try to inform, put the message out there, educate people, partners, people that are looking to get pregnant. We even advise student midwives or people that want to get into kind of the career space. So join us.
Yeah, on the
Just
journey.
check them out,
wait, have
guys.
you got time? Just a little. Alright, cool. Just a little quick question, because obviously you said about people that are looking to get pregnant. So I know that obviously it's not exactly so easy to get pregnant. Obviously, for me, for example, it was very bam quick in it. I don't know how, but in terms of some people, like, it's very hard to conceive, right?
Well, a lot of it is on the men as well, you know.
Yeah, and a lot of it is on the men, but
gonna
obviously that's no one talks about that, innit?
Yeah.
But what, in terms of advice that you can give for people kind of in that waiting period, not that is there anything they can try?
Or like they're
whatever,
trying,
but
but it's
what-
not happening.
Yeah,
like,
like what?
I think be open to options. I think not everyone can get pregnant the natural way, and that's just the truth of it. Might be down to you, or might be down to your partner as well. So I think always open yourself to other options, especially us people of color. I think sometimes we are against things like IVF, but it's there and it's available for you to actually have. And sometimes you have to go down that route to have a baby. That's the route you have to take. That's the route you have to take. I think obviously there's so many contributing factors as to why conceiving might not be as easy. But I think be informed. Like, I think like some people think that you can just, have intercourse on any day and then pregnant. No. There's certain days, there's certain periods where like you're more likely to get pregnant than others. There might be other contributing factors, fibroids, PCOS, endometriosis, all of these things. You have to get it checked out. Go to your doctors. If you think things are abnormal, go to your doctors, get things checked out. Blood tests. You can do fertility tests as well. There's so much things and options available that you have to look into. It's not just as easy as having intercourse and off you go. There's things that you might have to do medically, get checked out. Surgery sometimes to actually then move on to that place where you actually then start conceiving.
Yeah. And I'd also say, like, if you're actively planning to get pregnant, get yourself checked out before you start. Get your partner checked out. Like, sometimes we're trying, and it could be the men. So, like, get both of you get checked out. Know that you're all good to go, and then be patient with yourself. It's not something that can happen overnight.
It
might
happens
take
for some
time.
people, but not everyone.
Be patient with yourself. Give yourself grace, and don't give up. Like, if it's not happening, there's, like you said, there's other routes you can go about it. Like, at the end of the day, if the baby's what you want, there's ways to get there. So don't give up easily, and don't blame yourself if it's not happening as quickly as you thought it would. Like, women were so quick to be like, oh, why is my body not doing it? Body's failing you. It's not failing you. Sometimes things just don't happen. You just have to be patient and just find other ways that are best suited for you. That's it.
And in terms of for men, obviously, I don't know exactly what the process is, but obviously we know that from films and stuff like that, you see them having to go into the toilet
and
in
the
cup.
sperm count.
And there's magazines. Is that actually how it is, or is there actually other ways to?
So I think every IVF clinics, I think they all work differently. Obviously, that's not really our sector of things, but I think it works differently for every clinic. It just depends. Some they do blood tests, and some they do like the sperm count as well.
It can be different.
So it works differently for everyone. But men are just as part of the problem. So women don't just blame themselves. Things like smoking, terrible diets can also contribute. Drinking can also contribute to low sperm count. So.
No, fair. So everyone get checked out.
Everyone get checked out.
Okay, no, cool. All right, thank you guys very much. I really appreciate you guys coming out.
It's been fun.
Obviously, for the people that are looking to get pregnant, people that are pregnant, even the men, make sure you're educated. Make sure you actually go and check out their podcast, listen to what they're saying, and take the advice on it. But no, thank you guys really.
Thank you for having us. It's been fun.
Thank you.
Like, share, comment, subscribe, all of those things, and we'll catch you guys on Monday for Marriage Madness.
Peace out.
My mum's living comfy. No, we ain't the same as them. My brother's cutting through the city in Mercedes Benz. My face is cheap, but I can't even go Tesco. Broke days, I had no money for the cab home.